Hi, folks. My name is Dr. Amy Pearlman. I'm a board certified urologist with expertise in hormone health, sexual health, and genitourinary health. And my mission here is to bring technology in front of your eyes so you can see. We oftentimes talk about technology that's in the future, but the future is now. So I want you to understand what technology you can currently use either in your own medical practice, or if you're a patient, what technology you might ask if your medical provider can offer you. So it's all about bringing that knowledge to you. So I have two people here with me today, two very special people. I have Teddy and Bishara, and they are with the company Emano Flow. So I'm going to have them introduce themselves. So Teddy, why don't you kick us off here?
Hey, I'm Teddy, and one of the two co-founders of EmanoFlow, which is a product that we built that can measure urinary flow rate just from the sound of someone urinating into toilet water.
I'm the co-founder. I suppose we can get into our origin story a bit, but thank you for having us, Amy.
Awesome. And you both have, you both are physicists, which I think is fascinating. I'm just a urologist. And so I want to go through like, how did you even, because you gave us the elevator spiel here. How did you even get into this idea of wanting to track urine flow? So Teddy, why don't you tell us?
Yeah, absolutely. So yeah, as you said, we're both physicists, and my father's a urologist. So when I was getting my PhD in physics, I was hearing a lot of ideas of technologies that he was wanting someone else to pursue for him. And I was working on machine learning on noisy, complex biological image data. So trying to count bacteria in the gut of larval zebrafish using, you know, lasers and some fancy cameras. And so that technology, the ability to take an image and write some computer code to go in and extract information was exactly the kind of technology that was needed. When my dad pitched, the idea that really resonated. Do you think you could create something that could measure urinary flow rate just from the sound of someone peeing into toilet water? And so, it's kind of right place, right time, and right father son combination. And then yeah, Bashara
I
and I met
love
in
that.
physics grad school. So
I love that. You got your inspiration from your dad. Bashar, how about you? What was your inspo?
Yeah, I also come from a physician. My dad is a nephrologist, and Ted's dad was not the only person throwing business ideas at him during grad school. I've been wanting, I've always wanted to be an entrepreneur. I think I get that bug also from my dad. And also I was doing machine learning in graduate school, and it when Ted brought this idea to me, it sort of passed the smell test, and we got to prototyping. They brought some initial data to me, and it was a very compelling idea.
So when you say it passed the smell test, you're not actually saying that you had to smell the urine, are you?
Uh,
You're all
that's
dead.
2.0. Yeah, we'll introduce that sensor later.
So Bashar, what was it about this idea that Teddy came to you with that helped pass that smell test?
Well, I think there's a couple of trends in healthcare that stick out to me. I think there's a move towards increasing the amount of data that a physician has, and synthesizing that data into a consumable packet so that physicians can make more efficient decisions with patients. You see this in value-based care. You see this in private practices seeking to streamline the care of patients and also give patients a really tailored experience. More personalized data for a patient helps a shared decision making around what to do with a given diagnosis. And so, the also there's a plurality of opportunities when looking at the output of the urinary output. I mean, it is the output of the urine is the output of the cardiovascular system, and so there's a lot of signatures that are potentially a lot of signals in flow rate, volume, frequency, and so on, that could be very useful in the future when a lot of medicine is more data driven.
So just for the viewers, I want to explain how this technology works, at least from the, provider side. So as a urologist, I've been working with Emano Flow. And so I set up this online portal where when I have a patient who is coming in with some urinary symptoms, all I have to do is enter in like their name and like their phone number into this online portal. The patient will then get a text message with information on how to get the smartphone application onto their phone. And then all they have to do, and I've actually used this as a patient, although it's not validated in women, I just wanted to try it out for myself to understand how easy or difficult it might be, is I just gave the app access to the microphone on my smartphone. And then I would take my phone to the bathroom and I would have it listen to my urine hit the toilet water. And it will then graph my urinary flow. And what's really nice from the provider standpoint is I can then pull up all the graphs of the urinary flows for my patients over the last, 2 weeks to see what their flows look like. I can see what they look like during the day and the night. And it really, the data is only limited by the number of voids that person collects. So if they, voided 20 times in a day, I could potentially see all of that data. And it has been game changing for me because I have a concierge practice. I have limited sort of tools in my office when it comes to urinary health. So if I have a patient reporting a weak urinary stream, I don't want to guess if they have an issue. And I want to know, did the Cialis or other medication I put them on, did it help? Rather than relying on a questionnaire or my patient coming in 3 months later and me asking them, how's your urinary stream? I want that objective data. So from a healthcare provider side, it's really helpful. But why don't we talk about it a little bit more from a patient side? Why might this be helpful for a patient when we compare it to something that we typically use in the office, which is we have our patient come into a urology office. We tell them, go ahead and go to the bathroom, pee into this funnel. Like, why is your technology better than that technology?
I'm happy to take that. Yeah. So the first and foremost, scalability is a huge thing. So being able to very easily collect this data and not expend a lot of staff effort to be able to get the data on the practice side, but on the patient side, it's so much easier and so much more reliably collected. When we set out to build the technology, we knew that the patient in mind was likely to have things like urgency. Maybe they were older and less tech savvy, and so the technology had to meet them where they were at and be very easy for them to be compliant. And so, we've been able to accomplish that very, very successfully. But the advantage of getting a really representative sample of their real urinary flow is great for the patient and the physician. That a patient can really increase their self-awareness. I mean, all of us are terrible self-historians. The patient can see their urinary flow rate data alongside their physician, and that is really not possible with an in-office system. And EmanoFlow works delightfully, especially longitudinally. So as you're seeing a patient over the years, I mean, BPH is a slow onset disease, and it's grows slowly over time. And so to have that data over the course of months and years is facilitates the patient's self-awareness and shared decision making wonderfully.
And as more and more healthcare providers are offering telemedicine and big telemedicine platforms are coming out, it doesn't necessitate the patients coming to the office. So you can get that data when the person is in the comfort of their home and are peeing like they typically pee. If someone said to me, like every time I'm on my way to a lab or an office where I think I have to give a urine sample, I'm like, oh my God, I need to grab my water, like I need to hydrate. But we want to see what's happening when someone is going about their daily activity, because that's really how they're urinating, not when we make them urinate on demand. So Teddy,
Indeed.
oh yeah, go ahead, Bishara.
Oh, well, I was only going to add that we're seeing a lot of private practices, especially larger group, build pathways, and they're really looking for a combination of patient engagement, operational efficiency, and really leveraging their physician's time optimally, and having a take-home experience for the patient is a great way to extend care over time and remotely. And I think pairs very nicely with what they're trying to do.
Yeah. And it's a much easier way to do a voiding diary than how we typically have patients do a voiding diary. That's my opinion as a urologist. So, Teddy, for the healthcare providers watching and the potential patients, what do healthcare providers and patients need to know when it comes to how do people actually collect good data? How should they pee into the toilet? What's important here?
Yeah, absolutely. So we built this really thinking about the end user, the patient first. And so what the experience is you can open up the smartphone app and you can start your recording as you're walking into the bathroom. We made sure that we can isolate the urine in that audio file, and do the prediction. And so, I recommend starting it before you get there. That way you're not fumbling around with your phone when you really got to go. And then set it sort of anywhere like on a counter near the toilet. And then the most important thing is, urinate into the toilet water. And so, you want to make sure that there's no toilet paper in, you want to make sure that you're hitting the surface of the water, but it's about as simple as that. When we built this, we're physicists, we broke down the problem into its core elements and really made sure that it was independent of the height of the person, what their anatomy looked like, whether or not there was background noise, there could be radio blaring in the next room. And then, it doesn't matter the shape of the bathroom as well. We spent way too many hours collecting data to really test this and build it.
So what if someone is in a public restroom, so they can't use a urinal because they need to pee into water? And let's say they're in a stall, but someone else is peeing in the stall next to them. What happens in that situation?
Well, so from a data privacy perspective, I have to say, don't do a recording near someone else if you don't have their consent to do a recording. And so so the benefit of EmanoFlow versus a lot of the other ways of collecting this type of information is you just need your smartphone. It's just software. And so if you can find a private restroom in a public place like at the airport or if you're out to dinner, then go ahead and do the recording and try to find a nice clean surface to put your phone down on while you're doing that.
Teddy, I have a follow-up question. Have any phones been lost in the toilet in the setting
We
of doing these recordings?
None that have been reported, but I don't know. We've had some very interesting use cases. We had an individual, at this point we've had, thousands of patients that have used EmanoFlow, and there was an individual that was living on a boat and wondering whether or not they could use it in their, bucket that they were usually using to urinate in. We've had a lot of rural patients that, we're all from Oregon on the company, and here in Oregon, there's a lot of rural living and a lot of people that are up in the mountains, and so a lot of people are wondering if they can use it when they urinate outside while they're doing their farm work. And the answer is no. Find a private toilet, and I recommend not holding the phone so you don't drop it in the toilet. I hope no one has. Yeah.
So who are the ideal people who would benefit from using your technology when it comes
That's
on
a
the patient side?
great question. Yeah, yeah. So I think that people it definitely depends on the context. Mostly for the providers, it's being used by people who have enlarged prostate. But from a patient perspective, if you're an older guy and you have, urinary symptoms, that could be frequency, you're getting up at night to urinate. It could be nocturia. It could be, you feel like you have a weak stream compared to, when you were younger. Any kind of strange urinary symptoms, bring it up with your provider. See if it's something that they can offer you. And then I think it's also a really powerful tool for the patient to be able to see, like you were saying at the beginning, not just a subjective questionnaire that you have to fill out in clinic, but see objectively and follow objectively your frequency, your day versus night information, and then the sort of quality of your stream around an intervention. So if you're trialing a medication, if you're considering undergoing surgery, it's a great tool to obviously help your provider figure out what the best treatment is with you, but then also just see if it's working or not and get to the right solution, hopefully much more quickly.
So this technology is really validated for penis owners with really
Yes.
any type of lower urinary tract symptom. We oftentimes blame it on an enlarged prostate, but really could be urinary urgency, frequency, straining with urination, urinary hesitancy or intermittency. So really any bothersome lower urinary tract, or just someone who wants objective information on their urine stream. So we oftentimes pathologize or medicalize or say, well, you don't have a diagnosis, so we don't need to track something. But I would encourage people, even if they're healthy and don't have issues, it's like, that's really the time to get a good baseline. I'm a huge proponent of that. So on the healthcare provider side, who are the types of healthcare providers that you think would benefit from implementing technology like this into their clinics?
There's the obvious urologists, but primary care physicians to us it makes a lot of sense to have a scalable software-based tool in primary care, and doesn't require staff to set up a Uroflow and so on. I think there's got to be a handful of primary care physicians in the country who have access to a Uroflow.
And Uroflow machines are expensive. I mean, I was looking at getting one in my clinic and they're several $1,000s. I mean, and they're not that complicated. So that's why I use it in my practice, is because I didn't want to have to purchase that machine. And especially primary cares, there's so much guessing involved with the lower urinary tract because they don't have all the fancy equipment we do as urologists. I agree. Primary care docs are the majority providers that are seeing lower urinary tract dysfunction.
Absolutely. And they're often, forced to do it based off subjective symptoms and in a way fly blind. And so yeah, I think since it's only software, since we can get it set up instantly, I think that's a really, that would be a wonderful use case.
So for a lot of primary care providers may not have education when it comes to interpreting Euroflows. So does your company help educate people who might not be as familiar as urologists are?
It currently we don't have, any education in the software itself. But there's certainly things on our roadmap, like in particular wraparounds for intervention. So for primary care physicians, their primary source of treatment, or their primary means of treatment is medication. And so, it's luckily, the data is very simplified and well presented. And so you can definitely see changes in the data. And so if you're or no change. And so if your primary use case is in treating the most common urinary symptoms, then you can track those, instead of asking, do you feel you have a weak stream? You can see the max flow of the individual. You can see what the distribution is, and you can see it change over time. And then things like number of voids per day. So luckily, a lot of the data that we're collecting is pretty easily interpretable, but definitely interested in providing sort of more education over time.
Yeah. Well, I think that's really helpful that you just described that, because it doesn't require a urology board certification to understand the data, which I think is a really important point there. So in terms of innovation, like, are there things that you guys are thinking about, dreaming about, fantasizing about when it comes to your technology over the next 5 years, and what might that look like? You don't have to share all the secrets.
Yeah, definitely. Yeah, I mean, it's fun. It's cool. At the very beginning it was, can we solve this or not? And then what's really exciting about this is it is just software. And so like you've been speaking to, it can be a replacement for the voiding diary, which originally was a piece of paper, and often you have to go into your kitchen and pull out the Pyrex, measuring cup and urinate into that and write the individual flows down, and then bring this kind of messy piece of paper that's hopefully dry into your physician and show it to them, and they have to do the algebra to figure out if you're, say, nocturia, that the reason why you're getting up to pee at night, is that caused by a lower urinary tract issue like your prostate, or is it potentially cardiovascular disease? Is there potential that, the reason why you're getting up at night is driven by diabetes? And so for me, I think that world, that problem space is really juicy and rewarding. And I think that, we're getting kind of increasing interest from radiation oncologists, from folks that are treating, not just the overgrowth of the prostate, but who are treating prostate cancer, and in that treatment causing irritative symptoms, which you often see with treatments for benign prostatic hyperplasia as well. And so it's a surprisingly, rich tapestry of the use cases. And
I
so
love
that's
it.
a little bit of sort of where our interests are without getting into too detailed.
So it's juicy technology that's rich in tapestry and
And a
passes the
symphony
smell
of
test
signal.
and really provides data for both patients and healthcare providers that patients can collect in the comfort of their homes, and they get more of it. They're just not relying on one test when they're forced to urinate in a doctor's office. So I love that. So Bishara, where can people who might be interested on the provider side find out more information if they want to implement in their clinics?
The easiest thing is to go to our website. It's emanoflow.com. That's EMANOFLOW.com. There's a contact us form, reach out. And you can find both Ted and I on LinkedIn as well. It's that easy.
Awesome. Well, thank you both so much for joining me today. Teddy, Bishara, always a pleasure to talk with you.
Amy,
Wonderful.
thank you so much.
Thank you.